Welcome to Forward Motion class. My name is Jessica. I'm one of the physical therapists.
I'm Samantha. I'm an occupational therapist.
And we're going to talk today about what to expect from a physical and occupational therapy standpoint when you come to the hospital for your joint replacement. Physical therapy is going to focus more on getting in and out of bed and walking and going up and down stairs. We're also going to teach you your exercises. We will usually start on the day of your surgery or the day after your surgery, and we try to see you twice a day while you're here in the hospital until you're discharged. Depending on your surgeon's orders will depend on when we start, either the first day after your surgery or the day of your surgery.
With occupational therapy, we will focus more on your day-to-day activities, like getting dressed, getting bathed, getting to the toilet, just making sure you can do all the things that you normally need to do at home. We will most likely see you the day after surgery or post-operative day number 2, depending on your surgeon's orders. And we will see you one time a day until you're discharged.
Now, when you're in the hospital, you may experience some pain, you may experience some nausea, you may experience some dizziness, some lightheadedness. All of those things we see fairly frequently, and we work around those things with your nurses to make sure you get medication to help with your pain and medication to help with your nausea as much as we can so that you don't miss out on therapy time because of those symptoms. We're going to ask you about your pain while you're working with us before and after your session to make sure everything's going okay, and we want you to be talking to your nurse about how your pain is while you're here in the hospital, knowing that we are going to be coming to see you several times a day. So we don't want you to be in the bed in pain and not ask for your pain medicine until we come into the room. Try to get your pain medicine beforehand, and your nurses will be reminding you, and they'll write on the board when your pain medicine is due so that you can kind of prepare for that. You're also going to be hooked up to IVs, probably have a Foley catheter, possibly have some oxygen. We're very skilled at getting all of those lines and leads organized so that you won't miss therapy because you have those things attached to you. We get all of those organized. You can get into the bathroom. You can walk to the hallway with us. We will get all of those things kind of put together for you so that you move around as much as we can get you moving.
So while you're here in the hospital, we'll keep you covered up wearing a gown. You won't need to bring too much with you. You can bring a pair of comfortable clothing. We'll help you get dressed before you go home. If you have any special shoes, you might want to bring those since we will be getting up and moving around. Getting dressed, you might need some adaptive equipment that'll make things easier for you to be more independent at first, and we will go over that depending on if you need it or not. But a few of the items are something to help get your socks on. So this is called a sock aid, and we'll show you how to use it if you should need it. What you do is you fold it like a taco, okay? And you can hold it in one hand. And then with your other hand, you slide the sock on there just like that. So you can slide it all the way up to these little grooves. Good, and then pull the whole sock on there. Good. And then you take these 2 ropes, so one in each hand, and you throw it out in front of your foot. So that blue part will be on the ground. And then you stick your foot in there. Good. Try to get your toe all the way to the end if you can before you start pulling it up. There's a reacher. Can help with your pants, getting your socks off. And with the reacher, you're going to grab the front waistband of the pants. So right there. And then this just acts as an extension of your arm, so you lower it down by your foot. And then stick your foot into the hole. Good. And then once you can grab it, once you can reach, good. Good job. And there's a couple other things, a long handle shoe horn and a long handle sponge as well for when you're in the shower. So again, you don't need to bring too much stuff with you to the hospital, just a pair of comfortable clothes so the day that you go home we can help you get dressed. We have toothbrushes, toothpaste, lotion, and soap here, but if you have anything special that you want to bring, you can bring that too.
While you're in the hospital working on getting up and moving around, For your walking, we'll either get you on crutches or a walker, and we'll determine that based on your surgeon's orders and also how you're moving around. Some of the surgeons prefer the crutches, and they look like this. They fit on your arms like this, and you would walk in this manner with the crutches. If we don't feel that you're safe using these crutches, you have some injuries to your arms, or for any reason we don't feel that these are the most appropriate assistive device for you to use, we can have you using a walker. The walker usually has 2 wheels on the front. This is what it typically looks like, and you would just kind of walk with the walker like this. So we'll get you on either one of those as we're getting up and moving around, and the occupational therapist will be using those same assistive devices, and the nursing staff as well. So we try to be consistent. As we're progressing you, we're going to start to think about discharge planning and where you're going to go when you leave the hospital. From a therapy standpoint, what we'd like you to be able to do before you go home, if you're planning to go home, is that we'd like you to be able to walk at least a 50-foot distance with the appropriate assistive device to be able to get in and out of bed, get in and out of the bathroom, on and off a toilet, and be fairly mobile to be safe at home. Even if you're planning to have someone home with you, we still would like you to be able to get up with basic just supervision. If you're requiring more physical assistance or you're just progressing a little bit more slowly, we may recommend that you go to rehab when you leave the hospital, and the discharge planners can help determine which course of rehab will be appropriate for you. If you do go home, sometimes we recommend home physical therapy to come and see you, or home occupational therapy, so you may have visits when you're home from a therapist. We do recommend also that even if you are planning to go home, that you have someone that's going to be staying with you for at least 1 to 2 weeks, because even though you may be very mobile and getting around very well, we still need someone to be there with you to help you with meals, laundry, shopping, things like that that you're just not going to be able to do while you're still using your crutches and the walker. If you have physical therapy come to your house, typically they come 2 to 3 times a week for 30 to 45-minute sessions. If you go to rehab following the hospital stay, you could go to a skilled nursing facility or acute rehab. That will be based on your diagnosis, your medical issues that you have going on which route of rehab you take. Acute rehab is 3 hours of therapy a day in an acute rehab setting in a hospital typically, and then skilled nursing facility rehab involves 1 to 2 hours of therapy a day. Both of those settings you would get therapy every single day. With home physical therapy or occupational therapy, it would just be a few times a week.
Hello, my name is Alicia Mae Arthur. I'm your discharge planner, social worker. You normally will meet me on post-op day 1 or 2. To determine your discharge plan, we normally meet with physical therapy, occupational therapy, your nurse, and also, of course, the discharge planners every day to discuss your progress and also what your discharge plan is going to be. We base that off of physical therapist recommendations. They may recommend that you can go home with home health physical therapy. In that case, the physical therapist will come to your home about 3 times a week to work with you. Or either they may recommend outpatient rehab. That's when you pick an outpatient facility of your choice and you go there for rehabilitation. Another option is subacute rehab. That is actually all located in a skilled nursing facility. The best thing to do is go on www.medicare.gov to find the facility that's closer to you. You can go to Nursing Home Compare and put in your city and state. I would suggest that you be proactive and visit some of these facilities so you can get yourself familiarized with them. Another option is acute rehab. And also you must qualify for that. We actually have an acute rehab here in our hospital called Durham Rehab Institute. You may hear some people call it DRI. Of course, if you have a Medicare Advantage plan or either private insurance, for any rehab, you have to meet prior authorization from your insurance company, but we will submit the information for you. If you have straight Medicare, you do not require to have authorization. How do I get there? If you're going to subacute rehab or if you're going home, of course, you need your family or friend to pick you up. If you cannot get into a car, physical therapy will let us know, and we will try to arrange other transportation options for you, such as a wheelchair van. If you live locally, if you're going to a facility locally, the cost is between $60 to $75 because insurance do not pay for that. If you live out of the county, it's going to be more expensive, so that's why we encourage that you have a family or friend pick you up. Another way to get there is ambulance, but of course you have to be considered bedbound. Insurance do pay for this, but a lot of times you would not be considered bedbound. If you are going home, you also may need medical equipment such as forearm crutches, a 3-in-1 bedside commode, or rolling walker. If you have any of these items at home, please let your physical therapist know. If not, we will order those for you and have it delivered to your room.
So there's a few things that you can do prior to having your joint replacement to get your house prepared. As Jessica was saying, you want to have somebody staying with you in the first week, likely. They will help you with doing laundry and making your meals and just helping out around the house. You can also think about wanting to stay on the first level of your home if you have a 2-level home. Going up and down stairs several times a day just might be a little bit more difficult in the first couple of weeks that you're home. So if you can arrange to stay on the first level and there's a bathroom and a bedroom down there, that might make things easier for you. Also, thinking about when you're using these devices, walking around your home, you might want to remove any kind of area rugs to make things safer and easier for you to get around. Think about moving things that you use every day, like in the kitchen or in your bathroom, to a level where you don't have to be reaching down or reaching up, so that way they're always accessible to you. Thinking about how your bathroom is set up, you might want to have everything kind of at an accessible level so you don't have to be bending over to reach for things or reaching up into cabinets to get the things that you use often. Another thing, in your kitchen, you might want to have things more of an accessible level as well, things that you use often like cups or bowls, so you don't have to be unsafe while you're, getting yourself a glass of water or something like that.
And the last thing to think about is this equipment that I've been talking about. All of the equipment that we feel you need, we will provide for you or order for you before you leave the hospital. So you do not need to purchase or acquire any equipment prior to coming in for your surgery. If you already have equipment at home, that's fine, just let us know. We won't get you double equipment, but we'll take care of ordering what you need, recommending what we think you need. If you do go to rehab following your discharge, then at that point they will take care of the equipment needs that you have before you go home. But it's just important that you don't need to purchase or acquire any equipment before you come in. Hi, Mr. Smith, I'm Jessica. I'm the physical therapist.
Hi, nice to meet you.
You too. I'm going to be working with you this afternoon to teach you your exercises. So you had your knee replaced yesterday, so what I'm going to do today is just kind of go through the exercises you can be working on while you're here in the hospital and also when you get home.
Okay.
Okay? So they're right in that packet that's right next to you. And you're just going to flip it to the first page here. Right. And so what I'm going to do is just kind of pull your blankets down so we can take a look at that leg. There we go, right there. Okay, so this first exercise, you can see it says ankle pumps and ankle rotations. So all you're going to do with that exercise is just kind of move your ankle up and down, just kind of nice and slow, and you can do this for both ankles. Okay. Or you're going to just do gentle kind of rotations like this, in that direction or in the other direction. Any pain with that?
No.
Feels good? Okay. And you can kind of do those whenever you think about it, a few times a day, 8 to 10 repetitions or so.
Okay.
Okay? The second exercise you can see says quad set, knees straightening. So what that means is we're going to try to get this right knee to be a little bit straighter. So what I'd like to have you do is just bend your left knee. I'm going to put my hand underneath your knee, and you just try to push that leg down into the bed. You're going to hold it for a count of 5 seconds. So you want to relax everything else except for this muscle right here. You're going to count and then relax. Good. How'd that feel?
Felt good.
Yeah? So you push down, count 1, 2, 3, 4, 5, and then relax. And again, about 10 repetitions of this, just 3 to 4 times a day. Okay?
Okay.
Any questions with that one?
No.
Okay. Good. We're going to switch. Exercise number 3 says gluteal setting, buttocks contractions. So what that means is on either side of your bottom here, you're going to keep both legs straight and just kind of squeeze and contract and hold that for a count of 5 as well. Just 1, 2, 3, 4, 5, and then relax.
Okay.
Any pain with that?
No.
And then the only thing you want to not do with this is don't hold your breath.
Okay.
So if you count out loud to 5 while you're doing this one, you will tend to not hold your breath.
Got it.
But a lot of people do try to do that, so we like to remind you. All right, now this last exercise is called heel slides. So you're going to be working on bending this knee with that one. So you're going to bend your left knee up once again and just kind of keep that bent. That's going to help you to be able to move this one a little better. You're just going to slide this heel up towards your bottom until you start to feel a little stretch, and you let me know when you feel that, okay?
Okay.
You're just going to slide it up a little bit.
I feel a little stretch.
Right there. Okay, then you're just going to stop and then bring it all the way back down straight.
Okay.
So every time you do this, that will get a little bit more and a little bit more. Just nice and easy up, and then bring it down nice and slow. Good. Any questions on any of those exercises?
No.
Okay, so you can just be working on those while you're here in the hospital, and I hope they go well for you.
Thank you.
You're welcome.